In this lesson, we're talking about the signs and symptoms of congestive heart failure. Before we talk about those signs and symptoms, let's talk about what congestive heart failure is so we can better understand why the signs and symptoms occur. So, congestive heart failure is a condition involving an inability of the heart to pump blood effectively. Generally speaking, it's going to be due to damage to the heart muscle, which is also known as the myocardium. You can imagine that if there's damage to the heart muscle, it's not going to be able to contract and pump blood effectively. So it's not going to be able to push blood to places where it's supposed to go. Now, there are a variety of risk factors for getting congestive heart failure. We're going to talk about them here very quickly, but if you want more information, please check my full lesson on congestive heart failure. So some of the risk factors for getting congestive heart failure include coronary artery disease, previous myocardial infarction, which is a heart attack, diabetes, valvular heart disease, alcoholism, so this is often going to be chronic heavy alcohol consumption, hypertension, which is high blood pressure, so it's often going to be, again, a chronic history of high blood pressure, and then sleep disordered breathing, so conditions like sleep apnea. So in order to understand the signs and symptoms of congestive heart failure, we actually break down the heart into the right heart and the left heart. So we'll quickly talk about the anatomy of the heart here. So on the right heart, so if we're looking directly at the patient, this is the right side and this is the left side. So the right side of the heart is going to bring blood from the rest of the body. It's going to be deoxygenated blood from the superior vena cava and the inferior vena cava into the right atrium, which is then going to bring that blood into the right ventricle. And the right ventricle is going to contract and push blood through the pulmonic valve into the pulmonary arteries. These are actually called arteries, even though they still carry deoxygenated blood. And that blood's going to go to the lungs and then become oxygenated and then come back into the left heart through 4 pulmonary veins into the left atrium. The left atrium is then going to bring blood into the left ventricle, and then that left ventricle is going to contract and push that blood through the aortic valve into the aorta and supply the rest of the body with oxygenated blood. So knowing that anatomy, if we were to say that there is right heart failure, so the right side of the heart doesn't contract properly, for instance, there may be some damage to the myocardium on the right side of the heart, blood's continually being brought back into the right atrium and the right ventricle, but if it's not being pushed through the pulmonic valve and into the pulmonary arteries, it starts to back up into the superior and inferior vena cava and into other parts of the venous system. On the other side, if it's left heart failure, that means that blood is coming in from those pulmonary veins. And if that left side of the heart is not pumping blood effectively, what that means is that there's blood continuing to come in, but it's not being pushed through the aortic valve and into the aorta to supply the rest of the body. So that blood starts to actually back up into those pulmonary veins and ultimately into the lungs. And this is why we're going to see the signs and symptoms we're going to talk about in this lesson. So if it's right-sided heart failure, the body is going to show signs and symptoms. Whereas if it is left-sided heart failure, then what that means is that it's going to have blood being backed up into those pulmonary veins and into the lungs. So it's going to primarily be lung involvement if there's left-sided heart failure. Now, even though I break it down into right-sided and left-sided heart failure, oftentimes patients will have both sides of the heart being affected. So because of both of the effects that we talked about here, we're going to have a variety of signs and symptoms and clinical findings that occur in congestive heart failure. We're going to talk about those and why they occur as we go through this lesson. So we're first going to talk about left-sided heart failure. So left-sided heart failure is going to have 3 very characteristic and hallmark findings that are often brought up and talked about in clinical practice. So these are going to include dyspnea on exertion. So dyspnea is simply shortness of breath, and exertion is going to be during physical activity. So shortness of breath on exertion or activity, and it's going to be compared to baseline. So it's going to be compared to what was before the congestive heart failure. A classic example is if they have shortness of breath when walking up a flight of stairs, when before they didn't have this issue. And it can start out with dyspnea on exertion, but it can progress and become worsened to the point where there's dyspnea at rest or shortness of breath at rest. Another classic finding with left-sided heart failure is orthopnea. So orthopnea is going to be shortness of breath when lying down flat. Now this is going to be key. Lying down flat is going to be the problem. And what's often going to be noted is that the patient's going to require multiple pillows to catch their breath. So if you have multiple pillows, it sort of pushes the patient upward at an angle. And the reason that this is important is because if the patient's lying flat, there's going to be fluid in the lungs due to that backing up of blood into the lungs. So the backing up of blood into the lungs from that left-sided heart failure is going to lead to pulmonary edema. So there's going to be fluid that starts to back up into some of the other structures in the lungs. And if you're lying down flat, gravity is going to flatten out that fluid to cover the majority of the lung surface area. And in the case of using multiple pillows, the patient's head is propped up at an angle, and the gravity is going to bring that fluid down where there's other surface area of the lungs that is not affected. So this is the reason why using multiple pillows is helpful for these patients. And another important clinical finding with left-sided heart failure is something called paroxysmal nocturnal dyspnea, or PND. And this is where the patient wakes up in the middle of the night gasping for air. So they're sleeping and all of a sudden they wake up and they are short of breath. They can't catch their breath. And a classic story for a patient with paroxysmal nocturnal dyspnea would be they wake up all of a sudden in the middle of the night gasping for air and they run to a window and open it to get their breath or catch their breath. Some other signs and symptoms of left-sided heart failure include coughing. So coughing is going to occur in addition to the shortness of breath. And it's often going to be persistent and productive, so they can cough up some mucus. And this is going to be due to pulmonary edema, like all these findings we see with left-sided heart failure. And then some other lung findings that we can find include crackles on auscultation. So if you were to auscultate or use your stethoscope and check the lung areas, you're going to hear crackling, popping noises. And that's going to be due to pulmonary edema from all that fluid built up from the backing up of blood that's not being pumped effectively from the left side of the heart. So those are some of the lung findings we're going to see with left-sided heart failure. Now let's talk about right-sided heart failure. So right-sided heart failure is again going to be due to the right side of the heart not pumping blood effectively, and that's going to lead to a backing up of deoxygenated blood into the superior and inferior vena cava and into other parts of the venous system. This is going to lead to peripheral edema. So peripheral edema is going to look like this, so swelling of the extremities. And again, this is going to occur with right-sided heart failure. And another important finding with right-sided heart failure is distended jugular veins. And this is what we call the JVP, or the jugular venous pressure. So this is where, again, the jugular veins become engorged with blood. And this is actually a very important clinical measure. So there are methods where you get the patient to sit at a certain angle. When they sit at a higher angle, we see a reduction of the JVP. If you sit at a lower angle, you see an elevation of the JVP. And then you can use other clinical assessments like the hepatojugular reflex to see whether or not the JVP increases and how fast it actually reduces back down to where it should be. Again, these are very important clinical findings with regards to right-sided heart failure. And then some heart findings that we can see include tachycardia. So tachycardia is going to be an increased heart rate, and we can see what we call an S3 gallop. Some other findings with regards to right-sided heart failure include hepatomegaly. So hepatomegaly is going to be an enlarged liver. And the reason that we can see an enlarged liver is because there's a backup of blood, again, into the inferior vena cava and ultimately into the hepatic veins and other hepatic vessels. And that actually can lead to a swelling of the liver. And in some cases, if this is left for a long enough period of time, it can lead to damage of the liver and ultimately lead to liver failure. And then we can also see ascites as well. So ascites is going to be a swollen abdomen. It's going to look like this. So it's going to be filled with fluid. It's going to be peritoneal fluid. And this is going to be due to an increased pressure within those hepatic vessels, causing fluid to be exuded into the abdominal cavity. So this is the reason why we can see ascites, and ascites can also occur if there's liver failure as well. And then some other findings that we can see with congestive heart failure that can occur in both left and right-sided heart failure include fatigue. So excessive fatigue and feeling tired are going to be common findings with congestive heart failure. So you can imagine if the blood's not pumping effectively to the brain and other parts of the body, you're not going to feel like you have a lot of energy. So your energy levels are going to be quite low. And then we can also see cognitive deficits. So cognitive deficits can include memory issues, confusion, anxiety, sleep disruptions. And this is going to again be due to a reduction of blood supply to the brain and other parts of the central nervous system. And then we can also see chest pain. So chest pain may be pain or pressure. And this chest pain can be secondary to an underlying coronary artery disease or issues with hypertension due to that ineffective pumping of the blood. So that's going to lead to issues with blood going through the aortic valve and into the coronary arteries of the heart, and or hypoxia, which would be also due to the same mechanism. If we're not getting enough blood pumping through the heart, we're not going to get enough blood into the coronary vessels, and that's going to cause some anginal chest pain. So if you want to learn more about congestive heart failure, please check out my full lesson on this topic. And if you haven't already, please like and subscribe for more lessons like this one. Thank you so much for watching, and hope to see you next time.